Randy Elner and Jeff Greenberg first met while working at Brigham and Women's Hospital in Boston. While the two doctors loved practicing primary care, they realized there was something deeply flawed about a model that required patients to take half a day off of work for an appointment once or twice a year, when what they really needed was continuous engagement in order to change their behaviors. Plus, if you add a specialist to the mix, it could take weeks or even months to navigate referrals and get an appointment. Traditional primary care in the way that it's evolved in the US is being siloed off. It doesn't make sense anymore, says Elner, who also started the Harvard Medical School Center for Primary Care. A lot of the value opportunities were breaking down the boundaries between primary care, specialty care, behavioral health, urgent care, and offering a continuous technology-enabled service. To tackle these issues, the duo started virtual primary care startup Firefly Health as a side project in 2016, later bringing on health tech investor and entrepreneur Faye Rotenberg as president in 2019 prior to launching to customers. Also joining that year was Firefly's executive chairman, digital health rabble-rouser Jonathan Bush, who's also Rotenberg's husband. Bush had previously co-founded electronic health record and billing software company Athena Health. The Watertown, Massachusetts-based company began selling its solution to health insurers to help better manage certain patients on a per-member-per-month basis, and started adding offerings like behavioral healthcare and expanding virtual access to specialists. With $40 million in Series B funding led by Andreessen Horowitz announced Wednesday, Firefly is now going after the employer-sponsored market. Our mission is to provide half-priced healthcare that's twice as good, says Rotenberg, who is now Firefly's CEO. This new offering will be a full health plan benefit along the lines of Oakland, California-based vertically integrated health insurer and services provider Kaiser Permanente. The idea is to get fully insured small business owners, who are being crushed by rising employee healthcare costs, to switch to a self-insured pooled plan administered by Firefly with the promise of a reduction in their overall healthcare costs. With its thousands of initial customers, who are mostly in Massachusetts, Firefly has already been able to demonstrate a 52% reduction in emergency room admissions, which is where the highest cost care takes place. The company also increases engagement with patients, who interact with their Firefly clinical team more than 41 times a year. More interaction means better managed conditions, which translates into lower costs. Firefly saves an average of 30% on employee healthcare costs by moving patients to lower-cost settings and reducing unnecessary referrals and specialist costs.